replace one tooth, you can replace a full set of dentures and get back to potentially fixed teeth again. I've treated patients over the years that have said they could eat normal food again. They could eat a bagel, and before they couldn't eat a bagel. As subtle as that, and yet as serious as that. Their way of life, where food is now an aggravation or a compromise as compared to what they would like to enjoy. Instead of cutting things up into smaller pieces, the bite force of dentures is 5 or 10% of what natural teeth might be. They can go back to eating the foods that they'd like to enjoy and not think about it. An implant can help you get back to what you had as a teenager or as a young adult. As far as feeling natural, that you can clean it like you would your own teeth, you don't even know it's there, can feel as comfortable as it did before you had any dental problems at all, without anything feeling artificial. The success rates from the studies and my clinical practice are equal or greater than a conventional bridge. Typically they're going to be in the high 95 to 99% success rates. The key will be 1 year after we finish the restoration. If everything looks the same as the first day, there's no reason to think that potentially the implants can't last, and the teeth associated with it will not last a lifetime. No, it'll be done in the office. We're not in the hospital by any means. Local anesthetic, like any other dental procedure being done. If it's a single tooth, you may be at work that afternoon. If it's a larger case, you may just take that day off, but most patients the next day are back to their normal routine with minimal. Absolutely. I would be asking, how many have you done? How long have you been doing it for? What is your success rate? And where were you trained? Somebody might say, I've been doing it for 20 years. Well, maybe they did one case 20 years ago and they did one last year. So they did 2 cases in 20 years. That doesn't mean they're clinically significant that they could say they've got a 100% success rate. That's only on 2 patients over 20 years. So where they've been trained is very important, to say the least. And how many they've done and the success rate that they've had. Is this something that is a routine part of their practice, or is this something that they do sporadically? Makes a big difference. You know, I played tennis. I don't make a living at playing tennis, though. There's a big difference.